Good afternoon and welcome to the Illawarra Shoalhaven Local Health District Annual Public Meeting for 2024. I begin today by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders, past and present. We recognise and appreciate their deep connection to this land, water and greater community. I extend that respect to the Aboriginal and Torres Strait Islander peoples joining us in the room today and online from the many Aboriginal lands across our district. The Illawarra Shoalhaven Local Health District values our relationships with our local Aboriginal peoples. We are committed to reconciliation and recognition that the lands on which we operate are their traditional lands. We wish to express our gratitude that we share these lands today, our sorrow for the cost of that sharing, and our hope and belief that we can move to a place of equity, justice, and partnership together. Today we take time to reflect on the achievements of the past financial year. This meeting is an opportunity to recognise the peoples and the plans we have that help us to progress our vision. That vision is to ensure excellent services, quality partnerships, and healthy communities. I would like to welcome Margot, our Chief Executive, the District Executive, District staff, our local members and mayors, and members of the local community who are joining us online. I'd also like to welcome my fellow board members. Since the last annual public meeting, Dr. Rod McMahon reached his 10-year maximum term on the ISLHD board. Rod, who has been a GP in the Illawarra since 1979, was the first GP to be appointed to the former Illawarra Area Health Service Board in 1990, and he chaired that board from 1992 to 2004. On the ISLHD board, Rod chaired our Healthcare Quality and Safety Committee and the Medical and Dental Appointments Advisory Committee. His commitment to quality and safety and the support for staff was unwavering. On behalf of us all, thank you, Rod, for all that you have done for our district. Janine Cullen, our Deputy Board Chair, left the board in February to start a new life in the Northern Rivers. Her leadership has been defined by a genuine passion for making a difference and an unrelenting focus on delivering the best outcomes for our staff and the peoples we serve. Janine's impact will be felt in years to come, and her legacy is one of compassion, collaboration and innovation. My sincere thanks to all the board members, past and present, who bring a wealth of skills and experience that ensures the decisions that we make are always well considered and far-reaching. Today we celebrate the achievements of the district and note the progress of Year 2 of our Strategic Plan 2023 to 2028. The Strategic Delivery Plan, launched last year, continues to articulate the division's vision for the next 5 years. It guides the ongoing development of our organisation, staff, community and services. The board remains focused on overseeing and tracking progress in these areas, ensuring that systems are in place to achieve these goals. Having seen firsthand what the staff of the Illawarra Shoalhaven Local Health District and our community can achieve together, I am confident that the focus areas of this plan will continue to be delivered to the highest standard. Our Chief Executive, Margot, will now take us through the achievements of the Strategic Development Plan.
Good afternoon. Thank you, Chris, and welcome everybody. I too would like to acknowledge the traditional custodians of the South Coast on which ISLHD provides service and care, and pay my respects to elders past, present and emerging. ISLHD acknowledges the sacred interconnectedness and the intimate relationships that Aboriginal people have with this landscape, its waterways, winds and all living things, and that the connection to country is an innate part of identity, health, well-being and healing for all Aboriginal peoples. ISLHD acknowledges its role in the historical effect of colonisation and subsequent colonial policies that have and continue to have on the health and well-being of Aboriginal people of this district, as it commits to a journey of learning, truth-telling and healing in this plan and its service offering. I'd also like to acknowledge the beautiful artwork Garidian, meaning healer in Dharawal language, which is a fitting representation of our commitment to health and well-being. In this commissioned artwork by Jasmine Saran, the three large symbols represent the three major hospitals within ISLHD, Wollongong, Shellharbour and Shoalhaven, each reflecting the unique and diverse communities they serve. These hospital symbols are interconnected, symbolising the unity and collaboration across our health services. The smaller blue symbols represent our services, our outreach programs and our partnerships, while the earthy symbols represent the communities themselves, vast in number and central to everything we do. Last year, I had the great privilege of officially launching the ISLHD Strategic Delivery Plan 2023 to 2028 to our community. This plan, firmly grounded in the statewide strategic direction outlined in Future Health, guiding the next decade of care in New South Wales, 2022 to 2032, serves as a vital framework for our district. It's a tool designed to help us achieve our goals, strengthen health outcomes, and reinforce our shared vision of delivering excellent services, fostering quality partnerships, and building healthy communities. After navigating a period marked by sustained demand, significant challenges, and deep reflection, this plan offers us a fresh perspective, a renewed approach to ensuring we continue to provide outstanding healthcare to those who we serve. Since its release, I'm proud to report that we've already made great strides to meeting the ambitious goals laid out in the plan. Progress is tracked through clearly identified outcome measures and an annual assessment of completed projects or programs outlined in the district's annual plan. These efforts are not just milestones. They are meaningful steps forward in our commitment to delivering the very best care for our community. ISLHD is committed to delivering more specialised healthcare to our community, achieved through the development of integrated models of care, the expansion of hospitals and health facilities, and by bringing care closer to home for patients across our district. Guided by our 5-year strategic delivery plan, and supported by ongoing improvements to our facilities and systems, we are placing a stronger focus on wellbeing, preventative health, home and community-based care, and empowering patients as active partners in their health journeys. The strategic delivery plan is central to shaping our work. Each year, teams across ISLHD use this plan, along with the strategic implementation plan, to identify priorities and guide our annual planning processes. This ensures that every action we take aligns with our long-term vision. In the first year of the plan, we made significant progress in implementing our priorities and laying the groundwork for future success. We evaluated our baseline outcome measures and tracked our progress through annual process measures, which were documented in the 23-24 annual report. This report detailed the strategic actions achieved in the financial year, providing a clear foundation for what lies ahead. Now, as we move into the second year of the strategy, I'm excited to share how we are building on this progress to further our commitment to the health and well-being of our community. Together, we will continue to evolve our organisation, ensuring that this plan drives meaningful improvements and creates lasting benefits for those we serve. The first of our 6 strategic outcomes is ensuring that patients and carers have positive experiences and outcomes that truly matter. This means going beyond clinical care to focus on how people are treated and how they feel throughout their healthcare journey. Person-centred care is at the heart of this approach, emphasising that patients are active partners in their care. Key achievements this year include expanding hospital substitution and admission avoidance programs like the virtual hospital ward and hospital in the home, which enables patients to receive quality care in their home. We also implemented the NDIA discharge assessment template, ensuring safe and timely discharges for NDIS participants, and enhanced community engagement through extensive consultation and co-design initiatives. We successfully launched the Voluntary Assisted Dying Framework, offering compassionate support for end-of-life decisions and advanced cultural safety through 11 projects under the New South Wales Health Aboriginal Health Transformation Program. We have held numerous community consultation sessions for Milton Ulladulla, for David Berry, for the New Shellharbour Hospital and the New Shoalhaven Hospital to ensure that our healthcare services and initiatives are aligned with the needs, the preferences and the priorities of the people we serve. Importantly, we established a Consumer and Community Advisory Council, a forum for consumer members to bring their lived experience, their knowledge and their skills to engage with us on issues related to improving consumer and community experience. These accomplishments underscore our commitment to person-centred, inclusive care and reflect the progress we've made towards ensuring positive experiences and outcomes for patients and carers. Our second strategic outcome focuses on delivering safe care in all settings, ensuring timely and equitable access for everyone, including vulnerable populations. This means offering patients choices about where they receive their care, tailored to their needs and clinical requirements. By reducing hospital admissions and ensuring timely discharges, we aim to improve patient flow and optimise care delivery. Challenges in accessing residential aged care beds persist, but the aged care outreach service has been a resounding success, with 2,639 residents served and 84% of referrals managed at home without emergency department or hospital visits. This initiative highlights the importance of collaboration with aged care providers to together find sustainable solutions. To address the sustained demand on hospitals, particularly in emergency departments, we have implemented initiatives such as emergency short-stay assessment units, alternative ED pathways for non-admission cases, and programs like Hospital in the Home and virtual care to reduce hospital stays. Expanding the virtual hospital ward remains a priority, with community feedback helping to refine this service. Innovations like the Allied Health ED Navigator initiative, piloted in June, have improved patient care and efficiency in our emergency departments by integrating allied health professionals into the emergency setting. Similarly, the Minding of the Minutes initiative at Wollongong Hospital achieved a 75% improvement in ambulance transfer times, exceeding Ministry of Health targets with 94% completed within 30 minutes. This success reflects the value of multidisciplinary teamwork and coordination. Our surgery recovery plan has yielded positive outcomes, significantly reducing overdue planned surgery wait lists over the past year. By optimising theatre time and introducing innovative care models, we are ensuring more patients receive timely surgical care. A huge thank you to our external partners who have assisted in reducing these waiting lists through outsourced surgery. In August, we enacted a swift response to a scabies outbreak, providing precautionary treatment to 1,154 patients and 3,857 staff across all of our hospital sites. This exceptional effort underscores how lessons from the COVID-19 pandemic have strengthened our ability to manage infectious disease outbreaks effectively. Lastly, we have made significant improvement in the number of hospital-acquired complications, or HACs, achieving the target rates for 12 of the 14 HACs, which is a real improvement on last year. The HAC Working Party has played a critical role in reducing HACs by implementing targeted strategies to improve patient safety and care quality. These achievements demonstrate our ongoing commitment to improving access, safety, and quality of care across all settings for our community. Strategic Priority 3 emphasises collaboration with other organisations and the promotion of positive, healthy behaviours and easy care to help people manage chronic conditions effectively. To support this goal, the Aboriginal Health Strategy has been redesigned to better align with the evolving needs of the community, enhancing its capacity to deliver culturally safe and effective care. In line with our commitment to Aboriginal health equity, a draft ISLHD Aboriginal Workforce Plan has been developed. This plan focuses on increasing opportunities for Aboriginal employment, career progression, and representation across our services. Additionally, we have collaborated with local Aboriginal community-controlled health organisations to create a draft Aboriginal Partnership Agreement. This agreement reflects a shared vision and a mutual respect, fostering strong partnerships aimed at improving health outcomes for our Aboriginal communities. Our efforts to close the gap in health outcomes for Aboriginal people remain steadfast, prioritising culturally appropriate care and programs and enhancing the quality and cultural safety of mainstream health services for Aboriginal people and communities. In the area of mental health, the Safe Haven program has made a significant impact, supporting 473 individual guests and providing 3,023 occasions of service. The Mental Health Service, in collaboration with the Illawarra Shoalhaven Suicide Prevention Collaborative, has also developed safe side drug and alcohol testing. Patient satisfaction has increased significantly with the mental health community patient consumer experience rating reaching 98%. This year, we also launched the Aboriginal Mental Health Van. This van has played a pivotal role in community engagement, featuring at several events during Mental Health Month and meeting the needs of the local Aboriginal community. Lastly, childhood immunisation rates have also seen continued improvement. As of 2024, 99.2% of Aboriginal children and 94.6% of non-Aboriginal children were fully immunised at 5 years of age, meeting the target of 95%. These results reflect ongoing progress compared to previous years. Our people are the heart of everything we do, and their dedication is crucial to achieving our goals. Strategic Priority 4 emphasises the importance of having an engaged, a valued and a well-supported workforce. To provide the best care for our communities, We must create workplaces that are physically, psychologically and culturally safe. We are committed to fostering an environment where everyone feels valued, empowered and heard, enabling our staff to thrive and deliver exceptional care. Key accomplishments included the delivery of the Allied Health Workforce Strategy and the development of the ISLHD Wellbeing Strategy, both aimed at enhancing workforce capability and promoting staff health and resilience. The final phase of the organisational redesign has been implemented to better meet future health needs, ensuring a modern and adaptable workforce structure. To further support staff, the District established the People Matter Employee Survey Working Group, and we are in the process of developing the Illawarra Shoalhaven Local Health District Staff Council, which is built upon fostering collaborative engagement and representation across the organisation. The creation of the ISLHD Pride and Diversity Network and the availability of the LGBTIQA+ workplace inclusion training demonstrated a real commitment to inclusivity and support for diverse staff. These efforts contributed to measurable improvements, with the PMES reporting an increase in staff retention rate of 91% and an improvement in both job satisfaction and overall wellbeing. Additionally, the launch of the Kindside podcast provided a new platform for staff engagement, celebrating stories of kindness and connection across our organisation. Lastly, ISLHD has implemented a psychosocial risk framework in line with SafeWorks Code of Practice, which focuses on staff consultation to identify and clearly address risks. We also launched a project on preventing and managing occupational violence and aggression, with ongoing system improvements and pilot programs to enhance staff safety and wellbeing. This initiative prioritises psychological health alongside physical safety. Strategic Priority 5 emphasises the transformative power of research, innovation and digital advancements in revolutionising the way we deliver care. ISLHD remains committed to advancing clinical research and trials, investing in studies that enhance patient outcomes and fostering a really strong research culture. This year we launched the ISLHD Research Strategy 24 to 27, which charts a bold vision for advancing research within this district. Building on the successes of the previous plan, the strategy seeks to cultivate a robust research culture that supports seasoned researchers, nurtures early and mid-career clinicians, and ultimately benefits patients by providing cutting-edge, high-value care. We also continue to leverage data analytics to improve decision-making, for example, engaging the use of predictive analytics and looking at avoidable hospitalisation readmissions. Notably, our Cancer Clinical Trials Unit achieved a world-first milestone, treating the first patient in a groundbreaking trial for multiple myeloma led by Dr. Palmer at Wollongong Hospital. We also achieved 97% of our research governance application approvals within target. We continue to embrace data analytics, expand virtual care, and strengthen digital systems to provide a secure and seamless services. Research remains integral to prevention, to diagnosis and treatment, and we look forward to increasing clinical trials and implementing innovative care models. Strategic Priority 6 focuses on ensuring the sustainable management of our health system. New South Wales Health and our district share the responsibility for both financial and environmental sustainability. By operating as efficiently as possible, we can then allocate funding to areas of significant growth and better support our community. To achieve financial sustainability, we have developed ongoing efficiency improvement plans to optimise the use of resources so that we can focus on delivering high quality services whilst reducing unnecessary costs. We have begun establishing a robust governance structure to guide ISLHD's transition towards environmental sustainability, starting with a passionate board committed to this cause. I am incredibly proud of Dr. Kate Croker and the Rehabilitation and Medical Psychology team for securing one of the 11 coveted grants from the New South Wales Health Sustainable Futures Innovation Fund this year, and we really look forward to evaluating the outcomes of their trial initiatives. I also want to congratulate Dr. Sonny Putness, Dr. Simon Cook, Belinda Jensen, and the Division of Surgery, who was selected to be the surgical hub in the Ministry of Health's Net Zero Hub program, which aims to assess carbon emissions in our theatres, review our current procurement and our waste management practice, and explore innovative and sustainable alternatives. Additionally, our fleet services team is committed to creating a more sustainable fleet by replacing full petrol vehicles with hybrids. We are also working to install electrical vehicle charging stations at Wollongong and Shoalhaven hospitals, with plans to introduce fully electric vehicles to our fleet following this installation. Lastly, the new Shell Harbour Hospital, which is set to commence its build in the very near future, aims to be the first all-electrical hospital in New South Wales, capable of supporting future carbon neutral power use. A focus on value-based healthcare enables us to shift our attention from outputs to outcomes and to strive to deliver care that improves health outcomes that matter to patients. While it's impossible to capture all of our achievements, these top 10 highlight significant service developments across our district. We supported the Waminda Women's Health and Wellbeing Aboriginal Corporation's Birthing on Country program by completing phase 1. This collaborative initiative allows endorsed midwives employed by Waminda to provide care during labour and birth at Shoalhaven Hospital for women utilising Waminda's maternity service. As mentioned earlier, we also established the Aged Care Outreach Service to provide in-home care for individuals in residential aged care facilities, helping them to avoid unnecessary hospital visits. Additionally, we expanded the Transitional Aged Care program to support safe discharges for patients preparing for residential placement. In addressing substance abuse, we enhanced drug and alcohol care across various medical, allied health and nursing specialties through the establishment and upgrade of clinical services, including adult and youth counselling. This expansion led to a 25% increase in drug and alcohol workers throughout the district. To improve developmental outcomes for children before starting school, we increased access to preventative health checks in the early childhood sector. This also included the primary school mobile dental program, which provided preventative dental treatment to 972 children in the first 8 months. We developed and we implemented programs like Minding the Minutes and the emergency short stay optimisation at Wollongong Hospital to support timely access to care, resulting in improved hospital flows. We enhanced our commitment to environmental sustainability through initiatives aimed at reducing waste and increasing awareness. Notable efforts include the War on Waste, the establishment of the Climate Risk and Net Zero Task Force, and infrastructure works to support vehicle fleet electrification. Work commenced on the Wollongong Hospital Clinical Services Plan, ensuring that hospital services align with the current and future needs of our communities. This strategic plan will guide the delivery of clinical services and support sustainable healthcare improvements in the region. To address workforce shortages, ISLHD initiated targeted nursing recruitment campaigns to attract skilled national and international applicants. These campaigns included graduate-specific programs in high-demand areas such as mental health nursing. Additionally, e-learning orientation modules were developed to improve the onboarding process for new staff. To improve empathy and positivity, ISLHD launched The Kind Side, Stories from New South Wales Health podcast, which shares experience of staff, of visitors and our patients, whilst also highlighting inspiring acts of kindness. The podcast aims to foster understanding and compassion within healthcare, encouraging similar acts to create a supportive environment. Lastly, infrastructure development continued with $1.2 billion in hospital projects underway. Major works began on the Shoalhaven Hospital Acute Services Building, which is expanding and modernising healthcare services. Early works for the new Shellharbour Hospital were completed, and the Integrated Services Project was progressed, which includes expansions at Bulli and Wollongong hospitals. These initiatives reflect ISLHD's commitment to delivering world-class healthcare infrastructure and world-class services to our communities. This leads me into the next part of today's meeting. The redevelopment of Shoalhaven District Memorial Hospital is progressing well, marking a significant milestone in our commitment to improving healthcare access and services for the community. Scheduled to open in 2026, the new facility will feature state-of-the-art infrastructure to support expanded emergency services, surgical and inpatient services, which will address the growing needs of this region. This transformative project has been shaped by extensive consultation with the community and stakeholders, ensuring that it aligns with local priorities and delivers patient-centred care. I'd like to thank the Capital Works team and Health Infrastructure for their ongoing work in delivering these projects across the many sites. This project, along with the many others ongoing in the district, marks a really transformative era for our district. And I'm really pleased that our LHD has been given the funding to increase our capacity and deliver our services in modern fit-for-purpose spaces. To give you a closer look at what's to come, we are excited to share the new fly-through video of the redevelopment, showcasing the modern facilities and innovative design that will define Shoalhaven's healthcare future. As we reflect on the past year, I'm delighted to highlight some remarkable achievements and recognition that demonstrate the excellence and the dedication of people within our district. Year after year, I am simply astounded by the efforts of our staff, and this year is no different. Whilst I could spend hours talking about the incredible works and achievements of our people, I would like to spend the limited time we have today highlighting a few. I made the difficult decision to postpone the Saver Awards ceremony last November due to concerns around both COVID-19 and extreme weather. A great deal of work went into the rescheduling of that event at short notice, and I cannot thank everyone involved enough. The 2023 Saver Awards were instead held in February 2024, and I want to extend my sincere congratulations once again to all our winners. As of past Saver Awards, I was honoured to choose the winner of the Chief Executive's Award for Excellent. This year's winner, Dr. Shab Cook, has been an integral part of the virtually enhanced community care team since joining in 2020. She was involved in the development of the home monitoring service for COVID-19 patients and was instrumental in the establishment of the virtual hospital ward when it launched in July 2022. In addition to this year's winner, Wollongong Hospital Intensive Care Unit Technical Equipment Officer Lavinia Harvey was also acknowledged as the recipient of a highly commended award for excellence. This award acknowledged Lavinia's outstanding work ensuring the equipment and stores in the ICU are available, they're functioning, safe to use, as well as the positive impact she has on her colleagues. Congratulations, Shab and Lavinia, and all of the 2023 Saver Award winners. We also celebrated Wollongong Hospital Emergency Department registered nurse Jessica Roper, who was recognised during the International Women's Day Illawarra celebrations. Jess serves as a preceptor for new nurses and is a member of the paediatric leadership team. With a focus on improving mental health care in the emergency department, she is furthering her education through the Australian College of Nursing and a postgraduate certificate in critical care nursing. Additionally, Scott Leonard, ISLHD's ICT lead for Capital Works, was the first employee to achieve the Certified Health Informatician Australasia certification. This prestigious credential recognises his expertise in health informatics and his ability to apply this knowledge effectively. Furthermore, Wollongong anaesthetist Dr. Tanya Salak was endorsed as the new Vice President of the Australian and New Zealand College of Anaesthetists. Her appointment reflects her excellence and her dedication to this field. Tania will represent ANZCA's nearly 10,000 members, focusing on training, education and collaboration. Congratulations to Jess, to Scott and to Tania for their remarkable accomplishments. We are so fortunate to have such talented individuals in our district. Congratulations to the Wollongong Hospital Stroke team for having achieved the prestigious World Stroke Organisation Angels Gold Status Award, recognising your excellence in stroke treatment and care. To earn this gold status, the hospital demonstrated optimal outcomes, including timely treatment, coordinated care, appropriate scans, and ensuring that patients are discharged with medication to reduce future stroke risks. Achieving such results relies on outstanding teamwork across various services, from the emergency department through to the stroke unit. I also extend my congratulations to Tamara Blanche, a registered midwife with Binji and Bori Illawarra, for being named a finalist in the Excellence in Nursing and Midwifery Awards 2024. Tamara was one of 3 finalists in the Aboriginal Nurse Midwife of the Year category, which honours exceptional commitment to providing quality, culturally appropriate care for Aboriginal and Torres Strait Islander communities. A proud Yuin woman, Tamara has worked with the Binji and Bori Aboriginal Maternal Infant Child Health Team for 20 years and completed her Bachelor of Midwifery in 2011. Earlier this year, we engaged our youngest residents in a fun competition to name the 2 cranes involved in the Shoalhaven Hospital redevelopment. A huge thanks to Jack and Hugh for the creative names of Jane the Crane and Larry the Lifter. Additionally, I want to highlight the remarkable achievement of Catherine and Atasa, who recently graduated from the prestigious Next Generation of Leaders and Managers within New South Wales Health Program. This 2-year program not only provided them with a diploma in leadership and management, but also challenged them to apply their learning to real issues within the New South Wales health system. Lastly, this year we celebrated the amazing Margaret Young, a truly dedicated volunteer who was awarded Volunteer of the Ward at the New South Wales Health Award. Margaret, together with her husband Tony, provide unwavering support for mental health inpatients and staff, including really thoughtful gestures like providing homemade baked goods each weekend and Christmas gifts for staff to distribute. Her and their generosity and commitment embody the values of kindness and compassion that we strive to uphold. Margaret and Tony were also recipients of the 2023 Saviour Awards. In the next slide, we hear from Margaret on her role as a volunteer at Mirrabrook Mental Health Unit.
My name is Margaret Young and I happily volunteer for the Mental Health Unit of Shellharbour Hospital. My role there is basically to do some comfort cooking for the patients. I've got an affiliation with all mental health sufferers because I personally have been one as well at this hospital, in fact. When I was in the hospital, my sister brought in muffins and I handed them out with her, and that made me think, if I get out of here, that's what I'm going to do for the mental health patients.
To do that selflessly for someone is just exceptional.
And I mean, not even just the cakes and everything, like Christmas time, when they bring the gifts and they're wrapped, there's always thought put into that.
Because that's the biggest thing, like self-worth. And when you actually know that someone's thinking of you in your treatment, medication's one side, but psychosocial is huge in our industry. And Margaret brings that to everyone here. It's a delight, actually.
I always feel immense pride when discussing the achievements of our team. Beyond the awards, I'm continually inspired by our dedicated workforce, who consistently prioritise excellent care experiences and outcomes for the communities we serve. At this moment, I want to express my heartfelt gratitude. Thank you to the community for your engagement, to our board for your unwavering leadership and support, and most importantly, to all of our staff. Your agility and resilience over this extended period, along with your steadfast commitment to keeping people safe and healthy, has been truly inspirational. I also want to acknowledge the many community members who have generously volunteered their time and efforts over the past year. Whether through volunteering, fundraising, or donating to enhance our services, we value every contribution. Your support helps us provide the best possible care, and for that we are incredibly grateful. Thank you all for your dedication and your commitment.
Well, what an incredible year it has been in our district for our patients, our volunteers and our staff. The events that the board and I look forward to most each year are those opportunities we have to celebrate and recognise the exceptional staff and volunteers who make such a difference to our patients every day. And we look forward to more of these opportunities throughout 2025. We are immensely proud of the work that's being done across our district in every area. Of course, we continue to strive for excellence and innovation in service delivery, and it has been a privilege to see so many of our services and staff recognised this year for their outstanding achievements. The board and I are excited to share updates with you next year on the progress that we've been made against the priorities outlined in the Strategic Delivery Plan. Together, I am confident we will continue to build on this momentum and achieve great things in our communities. Finally, I would like to take an opportunity to congratulate Margot Mains on her remarkable 10-year tenure as Chief Executive of ISLHD. Margot, your decade of leadership has left an enduring legacy of our district. You have guided ISLHD through significant challenges and milestones, always with an unwavering commitment to excellence, and compassion. Your vision has driven meaningful change, improved healthcare outcomes, and strengthened our connection with the communities that we serve. On behalf of the board, our staff and our communities, thank you for everything you have achieved. Your dedication and leadership will continue to inspire us as together we build on the strong foundation that you have created. On behalf of the board of ISLHD and our Chief Executive, Margot, thank you for being part of today's annual public meeting. I would like to extend my gratitude to everyone who has helped make today's event a success and to those who continue to contribute to the implementation of the Strategic Delivery Plan. Your hard work and dedication are the driving forces behind our success. A special thank you to Relativity for filming this meeting, ensuring that we remain connected to our wider community. As we reflect on the past year, it's clear that 2024 has been a year of significant milestones and achievements. Looking ahead to 2025, I'm excited about the opportunities that lie before us and the work that we'll continue to do together. With the holiday season upon us, I would like to wish you all a joyful and safe Christmas and New Year, and thank you for your attendance.